Hello and welcome to the latest Foundation Years podcast. I'm Seb Thorpe, Head of Begin Bright, and I'm really pleased you could join us for what promises to be a very important and timely discussion. Today, we'll be focusing on the upcoming early years safeguarding changes to the EYFS, which will come into force in September 2025. These reforms are designed to strengthen safeguarding practice across all early years settings, ensuring that we continue to provide the safest possible environments for young children to learn, play and thrive. We're fortunate to be joined by a panel of experts who will help us unpack what these changes mean in practice. Firstly, from the Department for Education, we have Laura Lindon, who will provide an overview of the key changes and the policy intentions behind them. And then from Ofsted, we're joined by Caroline Hearn and Wendy Ratcliffe, who will share insights on how these reforms will shape inspection frameworks and expectations for providers. Our aim today is to give you clarity and practical information and confidence as we all prepare for these changes. Whether you're working in a nursery, preschool or childminder, we hope you'll find today's podcast both informative and supportive as I firstly introduce Laura Lindon from the Department for Education.
Thank you, Seb. My role in the Department for Education is the team leader for early years safeguarding health and wellbeing, and my team led the early years foundation stage safeguarding reforms that are coming into force in September 2025. You can access an earlier vodcast on the changes, which goes into much more detail, and a link to this will be provided. However, for today, I will briefly outline the changes and then pass over to Ofsted, who will be answering some frequently asked questions. I'll start with some background. Following extensive engagement with the sector and safeguarding experts, we developed a number of proposed changes to the EYFS to ensure the safeguarding requirements are comprehensive and suitably robust to help providers keep children as safe as possible. We consulted on the proposals between the 22nd of April and the 17th of June 2024 and received 1,470 responses. Our official response to the consultation can be found on gov.uk. The consultation found strong support from respondents for all of the proposals we consulted on, with clear consensus that the safeguarding reforms will improve children's safety and align with current best practice in early years settings. Based on consultation responses, ministers decided to proceed with implementing all of the consultation proposals. Our hope is that these EYFS changes will provide early years educators with the clarity and support they need to deliver the highest quality, safest early education and childcare provision possible. I'll now run through the key proposals that we'll be implementing. The safeguarding changes include amendments to promote safer recruitment, including new expectations to provide references, requirements to obtain references, and a requirement for safeguarding policies to include procedures to help ensure that only suitable individuals are recruited. New requirements for providers to follow up if a child is absent for a prolonged period of time, and amendments to ensure providers hold additional emergency contact details. New requirements to ensure safer eating, including new requirements around allergies and anaphylaxis, introduction of solid foods and choking prevention, creation of a safeguarding training criteria annex, a safeguarding training renewal period of every 2 years, and a requirement for safeguarding policies to include details of how safeguarding training is delivered, including how educators are supported to put it into place. Amendments to ensure that early years students and trainees are required to have paediatric first aid training in order for them to be included in ratios at the level below their level of study. New whistleblowing requirements to make it clearer when and how to escalate safeguarding concerns and support practitioner confidence with regards to whistleblowing. Amendments to ensure that children's privacy during nappy changing and toileting is considered and balanced with safeguarding considerations. And a small number of minor changes to the structure and wording of the safeguarding requirements to improve clarity. For further detail on each of the safeguarding proposals individually, including the responses to the consultation and the reasons behind the decisions made, please take a look at the government's consultation response. The department is aiming to bring the changes in for the 1st of September 2025, subject to parliamentary procedure. To support the sector understand the changes, we have published a page on the Foundation Years website with further information and resources on the safeguarding changes. This includes a vodcast, a table summarising the changes with the exact EYFS wording, and posters to help you communicate to other educators about the changes. The department's Help for Early Years Providers website also offers guidance for people who work in early years. This includes guidance on food safety and internet safety, alongside a whole range of other topics.
Thank you so much, Laura, for that clear and helpful overview. It's been really important to hear about how these changes will come into play and what the drivers are behind them. So thank you very much. And I'm now very pleased to welcome both Caroline Hearn and Wendy Ratcliffe from Ofsted, who will be sharing their perspectives on how these reforms will influence inspection practice and what early years providers can expect as they prepare for the implementation. Hi, Wendy. Hi, Caroline.
Hi.
And now we can move on to a series of questions for both Wendy and Caroline. And I'm very much looking forward to hearing your thoughts on how these reforms will be implemented. So firstly, the updated EYFS now asks that references should be provided for previous employees upon request in a timely manner. How will Ofsted monitor this?
I just wonder, before we get into the questions, is it worth just doing a very high level overview about how, as an organisation, we inspect in line with principles and requirements of the DfE's EYFS, and our inspectors are charged with finding out what it's like to be a child in their early years setting. So very much, you know, these changes are really important that are coming in for the 1st of September, but just want to reassure colleagues that inspection isn't a compliance checklist, so it won't be that inspectors will or will not ask about some of these changes as part of that inspection process. It will depend on what they're seeing, what's it like to be a child, and it may be that they will be needing to follow up particular things. I just thought that would be helpful context first.
Yeah, thank you.
Caroline, are you going to answer that question?
I absolutely will answer that question. It's really helpful to get the context around inspection, I think, because people worry that it will be some sort of checklist that we come out and look at everything. But we don't, but we do expect compliance with everything, but we don't necessarily check everything at every visit, because that would make a very long visit. And actually, the majority of providers out there are doing a really amazing job and very good with compliance with the EYFS. So going back to your question of references, we know that times providers experience challenges in obtaining timely references within the early years sector, with many employers only providing very basic references that confirm employment dates, and some people refusing to provide references at all. And this can make it really challenging to carry out safer recruitment practices. This is something that inspectors will hold discussions about, ensuring providers understand what a reference should contain and the importance of this. Should we have concerns reported to us that references are not being made available, we may call the provider who's not providing the references to talk to them about what's causing the delay. And timely is interesting within that. So timely be what is reasonable. It might be someone's been away or unwell. So we take all those sorts of things into consideration when having those discussions.
Oh, thank you. And to move on, a point that Laura touched upon earlier, in terms of children being absent, what is a prolonged absence? And could you be specific about this? And what would Ofsted expect settings to follow up on in terms of a prolonged absence?
Yeah, absolutely interesting one. So inspectors will discuss what the setting absence policy is and how it's being implemented, and it will include finding out about providers and how they consider individual children's home lives and the circumstances, and this is how this impacts their decision making. It's about you knowing your children and doing the right thing for your children. Inspectors will evaluate how providers monitor and take action on children's absences based on what they know about the children. For example, is there a particular vulnerable child? Providers may take more significant action quicker if there's a child they're particularly worried about, other issues going on. Ultimately, inspectors will want to hear about how implementing this policy is keeping all children safe and well and supports an effective safeguarding culture within the setting. And as with the last question, there's a purposeful ambiguity contained in the legal requirements. So where the EYFS is not prescriptive, it means it should be for them to use their professional judgment to determine what's right for you and, most importantly, what's right for your children, and being able to clearly articulate that decision process to our inspectors, and why you feel it's reasonable that that amount of time has lapsed, or you've gone for a particular time frame that you have, and it will be different for different people. So that's why there's that intended ambiguity within there.
Wonderful, thank you. And something that came up a few times was in relation to students, volunteers and apprentices within settings. What if they don't have the experience or confidence to be included in the ratios at their level, at the level below their level of study?
I'm happy to take this one, and again, it's an interesting one that comes up. So the EYFS requires that staffing arrangements must meet the needs of all children and ensure their safety. So there is no requirement in the EYFS to include students, volunteers and apprentices in ratios, and if providers feel this would impact safety, then they must not do so. So what the EYFS does do, it does give that flexibility to include students, volunteers and apprentices in the ratios at the level below their level of study if, as a provider, you're satisfied that they are competent and responsible. And only where they are included in ratios will they need to have a paediatric first aid certificate. So this will increase the number of paediatric first aid trained staff in settings and enhance safety. Good to say though, just because you can include students, volunteers and apprentices in ratios, that doesn't mean you should. Again, it's about doing the right thing for your children within the context that you're working in. So it's got that flexibility there, but it's about doing the right thing for children. And if you're doing the right thing for children, you're doing the right thing for Ofsted.
Thank you, Wendy. And something else to move on to that Laura did touch upon earlier as well was around the proposed new requirement for privacy during toileting and nappy changing, ensuring adequate supervision of all children, in particular for educators working alone.
Yeah, I'm happy to answer this one as well. And I think this proposal is clear that children's privacy must be balanced with safeguarding. And so in some cases, I don't know, if you're a lone childminder, then this may mean a childminder meeting the requirement by using themselves as a shield, so that they can shield a child whilst maintaining their privacy, while also ensuring adequate supervision and safety of the other children in their care, if that makes sense.
Absolutely, it does. Thank you. And still on the theme of lone adults within settings, do lone childminders need to follow requirements to provide and offer employment references? Do they have to have recruitment policies in place and have whistleblowing procedures for staff in place?
I'm going to leave Caroline to take that one.
Absolutely.
On references.
Absolutely. So the requirements for safer recruitment whistleblowing are not relevant to lone working childminders. They're working on their own, that they have no staff or employees or volunteers. So they've got nobody and they're on their own. It's not possible to provide references with no staff or what to expect. You don't have the staff to do that for. However, it do need to be clear that our inspectors at point of registration will still be asking about that, because we register you to set up your business in the way that works for you. So you may be intending to be a lone worker. 6 months in, you might think, actually, I'd like to take on an assistant now. I can do that. They do need to let us know, but we need to know that they are ready to deliver the full raft of the EYFS. So have a look at it if you're coming in to register as a childminder, just so that you understand what you'd have to do if you took on staff. But no, we wouldn't expect it if you didn't.
Great. Thank you, Caroline. Moving on to another question, change of topic. When a child experiences a choking incident that requires intervention, providers should record details of where and how the child choked and ensure parents and or carers are made aware. What do the DfE Ofsted consider to be intervention?
Happy to take that question. It's an interesting one, isn't it? Because it's one of those grey areas where people worry, what does intervention mean? And the department have clarified that anything an adult is seen to do if a child seems to be choking, so if they're patting the child on the back or checking their mouth, any kind of intervention, I'm using that word in the sentence, but just if you needed to pat a child on the back, check their mouth's clear. Sadly, we've seen some really distressing situations with choking instances, so having an awareness of food and what's going on is really important for young children.
Thank you. And if you could move on to some new wording in the reforms. So in the new reforms, it states that babies and young children should be seated safely in a high chair or appropriately sized low chair while eating. Where possible, there should be a designated eating space where distractions are minimised. Do childminders need to invest in expensive low chairs which they cannot afford to buy and do not have space to store? Most childminders use their dining table with normal dining chairs once children have grown out of high chairs. Will this still be acceptable?
I'm happy to answer that one. And yeah, absolutely. Childminders will not need to be investing in expensive low chairs. This requirement is a should, meaning childminders must take this into account and should follow it unless there's good reason not to. But it's about ensuring that babies and young children are seated safely.
And again, some more new wording from within the reforms. Where possible, there should be a designated eating space where distractions are minimised. Can we still take children on picnics? And some childminders have heard that they can't allow picnics anymore because of distractions and the fact that children will not be in high or low chairs when eating.
We definitely don't want to stop childminders taking children on picnics. This is about providers using their professional judgment to decide what constitutes as a distraction while children are eating. That's the important thing. And the aim of this change is to ensure that as far as possible, children and educators are focused on the meal time, so staff are alert to things like incidents of silent choking and the great opportunities for that social interaction during these important routine times. And picnics could be part of a whole range of experiences offered to children, so careful consideration needs to be given to how you will sit together so children can be seen and heard during those important times.
Thank you. And finally, does the paediatric first aid requirement for students being included in the ratio also apply to qualified practitioners? For example, can only qualified practitioners be counted in the ratio if they hold paediatric first aid?
Okay, happy to take that one. So the new paediatric first aid requirement applies to students, volunteers and apprentices. The existing paediatric first aid requirements for qualified staff set out that at least one person has a current paediatric first aid certificate, and they must be on the premises and available at all times when children are present and must accompany children on outings. And the certificate must be a full course consistent with the criteria set out in Annex A. The paediatric first aid training must be renewed every 3 years and be relevant for people caring for young children and babies. And providers should take into account the number of children, staff, and the layout of the premises to ensure that the paediatric first aider is able to respond to in emergencies and quickly. So there's lots of things to think about there when you're unpacking that in terms of making sure that person can get to where they need to be. And that will be different for different providers because different building layouts will be different. But all staff who obtain level 2 and or level 3 qualifications since the 30th of June 2016 must obtain a paediatric first aid qualification within 3 months of starting work in order to be included in the required staff child ratios at level 2 or level 3 in an earlier setting. To continue to be included in the ratio requirement, the certificate must be renewed every 3 years. It's also important to note that whilst children are eating, there should always be a childminder or assistant in the room, or a member of staff in the room with a valid paediatric first aid certificate with full course content for the criteria set out in Annex A. So the difference is when children are eating, somebody with a first aid qualification has to be in that room rather than that easily deployable across the provision. It's in the room while children are eating.
Wonderful. Thank you for clarifying that, Caroline. And that brings our questions for today to a close. Thank you so much to our speakers, Laura, Wendy and Caroline. Really loved to hear your insights there and your really valuable thoughts on how the important safeguarding reforms will be implemented from September of this year. And of course, thank you to everyone within our audience for joining us. We hope that you found today's recording informative and that it helps you to feel a little bit more confident and more prepared for when these changes come into effect from September. And the work that you do every day to keep children safe and supported is truly vital. So thank you for engaging.